Hi everyone, my name is Jordan Miller and I'm a research fellow at the University of Aberdeen in Scotland. I've recently graduated from my PhD, which was conducted at the University of Stirling in Scotland, and my thesis was on understanding the emotional barriers to organ donation under opt-out legislation. My research was supervised by Professor Ronan O'Carroll, Dr. Sinead Curry and Dr. Leslie McGregor, and I was delighted to be asked to contribute a talk towards the Donor Research Network's Week of Talks. I'm going to discuss two of the studies that I conducted during my PhD. One, which is a qualitative interview study with people who plan to opt out, and we wanted to conduct this to explore some of the specific barriers under this new law. And then the second study is a follow-up experimental study that explored one of the barriers that emerged throughout my interview study in more detail. Now I'm just going to share my slides. Okay, so I'm aware that there's a global audience today. So the University of Stirling is a university that's located in central Scotland. Okay, so first for a little bit of background. Although in the last decade there has been a substantial increase in the number of organ donors in the UK, there remains a serious shortage of available organs. Between 2019 and 2020, around 1,000 people in the UK died during the wait for a transplant. Now, I've presented pre-COVID-19 data because this has had a substantial impact on the number of transplants, and the current figures are not actually an accurate reflection of true need. There's a similar global picture. So since 2018, there's been a 4.8% increase in global transplant activity. However, taken together, this all meets less than 10% of global transplantation needs. The shortage of organ donors is really compounded by the fact that only a very small proportion of UK deaths occur in circumstances where organ donation is actually a viable option. So you can see that there were 620,000 deaths between this time frame, between April and March last year, and actually just over 1% were eligible organ donors. And of that number, only around 20% of those eligible actually go on to donate their organs. Again, there's a very similar picture elsewhere in the world, with 2% of deaths in Australia and only 0.3% of deaths in the US. So in an attempt to increase the number of organ donors, many nations have recently changed the choice architecture of consent for organ donation and have introduced an opt-out donor system. Now, before March of this year, Scotland had an opt-in system where you actively sign up and join the organ donor register if you want to donate your organs. However, while around 80 to 90% of the UK public support organ donation, report favourable donation attitudes, and they say that they would want to donate their organs, just 40% are actually registered as organ donors. Now, this is a clear example of an intention behaviour gap. And overall, this discrepancy between an individual's favourable attitudes, their intentions, and their subsequent behaviour suggests that rational cognitive factors do not exclusively drive donor decision-making. So under an opt-out system, there's now no requirement to actively register as an organ donor. Instead, if no donor decision is recorded, eligible adults are presumed to be in favour of donating their organs. And if you don't want to be an organ donor, you must actively opt out of the donor register. Ultimately, the rationale behind this system is that altering the default position to consent should align with the majority of the public's support and positive intentions towards organ donation. Overall, this should act in theory to bridge the gap between the public's favourable intentions towards organ donation and their inaction, which should ultimately increase the number of potential organ donors. Now, the original aim of my thesis, which started in October 2017, was actually to explore the barriers to organ donation and to investigate various interventions to increase the number of donor registrations, things like reciprocity primes and reciprocal altruism. However, not long before the project started, the Scottish Government announced plans to introduce an opt-out system, and then very shortly after, the UK Government also announced plans to change the donor law in England. So this presented a really unique opportunity to actually focus my PhD on the transition to opt-out consent in Scotland and England. Now, my research focuses on the emotional barriers to organ donation, and overall, a large body of research has shown that in relation to organ donation, rational cognitive factors are relatively poor predictors of organ donor behaviour. Instead, a number of studies have shown that affective attitudes are the key barriers to people registering as organ donors. Now, when I say emotional barriers or affective attitudes, this describes deep-seated beliefs that are associated with emotion or affect. And these beliefs can often arise independent from direct experience with organ donation, and they often represent quite an instinctual gut response to the thought of organ donation. And the 4 examples that have been referenced heavily within the organ donation literature include medical mistrust, so the idea that doctors won't try as hard to save your life if they know that you're an organ donor, bodily integrity, the ick factor, and the jinx factor. Now, we know from extensive research that these are really key in nations with an opt-in system, where you actively register as an organ donor. But no research has explored these in relation to opt-out consent. Now, this is particularly important because the introduction of this law has actually had a negative impact and reduced rates of organ donation in some countries, for example, in Brazil, in Chile, and more recently in France. Specifically in Brazil, the opt-out laws were actually reversed after they caused an increase in fear surrounding medical mistrust and government control. Now, notably, it was concerns over these factors that actually caused the Organ Donation Task Force in the UK to advise against the introduction of opt-out laws in 2008. Now, although this was over 10 years ago, recent research from the Scottish Parliament has actually shown that 1 in 5 people in Scotland are planning to opt out. So overall, investigating the factors that influence organ donor decisions are really important. Now, I'm going to focus today on the principal aim of my research, which was to develop a greater understanding of the barriers to organ donation. And we had a specific focus on understanding the barriers in relation to this new legislation, opt-out consent. So my thesis included 5 studies. We used mixed methodology. So there was a preliminary quantitative questionnaire, a qualitative analysis of free text responses, which explored the reasons behind participants' donor choices, qualitative interview study with people who plan to opt out, an experimental study that explored one of the barriers that emerged within this research, the role of reactants, and then a systematic review which looked at family consent and the factors influencing consent and refusal for posthumous organ donation. Again, I'm going to focus this talk on 2 of these studies, qualitative interview study and the experimental study on reactants. So this research was conducted 2 years ago, and at that time, no research had explored the viewpoint of people who plan to opt out of organ donation. Elsewhere, Wales within the UK had implemented this system in 2015. 6% of the population have actively opted out, but there is still no research that explores this, why this group have opted out of organ donation. We know that from existing research that public beliefs about organ donation can often be predicated on myths and misconceptions. So overall, understanding the viewpoint of this particular group is really important in the context of such a sensitive legislative change. In the context of the UK, this is of key importance, given that last year, actually more people opted out of organ donation than those who actively registered as organ donors, and that's quite concerning. So the objectives of this study were to examine attitudes towards organ donation, different consent systems, an opt-in, traditional opt-in system and an opt-out system, and to gain an in-depth understanding of why people plan to opt out of organ donation. So for this study, only people who plan to opt out of organ donation were included. We used telephone interviews, and this was selected over face-to-face interviews because existing evidence suggests that telephone interviews are particularly effective when exploring potentially sensitive topics, as in this study. We recruited participants via social media and also eligible participants from previous research who had said that they would opt out of the organ donor register and gave consent to participate in a follow-up interview study. However, this only resulted in 4 interviews, so we actually opened the study up to online recruitment and were able to gather another 11 interviews from this method. And as an incentive, participants were offered a £5 Amazon voucher. We analysed the data using Brown and Clark's approach to thematic analysis, and the data was managed using Quirkos software. Now here's an example of line-by-line coding within Quirkos. It's from a different project, but it's just for illustrative purposes. So overall, 15 participants who self-report the intention to opt out of organ donation participated in this study. Participants had a mean age of 45, and that ranged from 19 to 83. Our female sample was 60% and 40% were male, so there was a fair, even distribution there. Most of the participants were resident in Scotland, with only 1 participant who lived in England. 13 were not registered as organ donors. 1 had actively opted out of the donor register already. Now, this option had been available since 2016, so you can actually actively opt out of the donor register already. And 1 participant was a registered organ donor. So we overall found 3 overarching themes: consent versus coercion, self-protection, and riddled with pitfalls. So our first theme. Now this really concerns the views on the opt-in system. So having to actively register as an organ donor for your consent to be recorded. Overall, the non-intrusive nature and the freedom of choice offered within the opt-in system was considerably favoured. Overall, participants reported that actively seeking out the means to register as an organ donor clearly demonstrates their consent to have been informed and the decision of voluntary choice. So the largest excerpt here from Luke describes his experience as a nurse to emphasise the importance of informed consent. So as a nurse, before I do anything, I ask for consent. I don't just go and take someone's blood and then go, is that okay that I've just taken your blood? So in my opinion, you need to ask for consent, and that's what an opt-in system does. It asks for consent. So this really emphasises the importance and the ethical implications of true informed consent. Overall, participants held strong views about having individual responsibility and autonomy when making the very personal decision to donate or not to donate their organs. Now, in almost a direct contrast, the opt-out system was perceived as forceful and intrusive. And as Olivia states, this represented sort of coercive action from the government, which to her was an almost alien concept. As she says, that's just anathema to me. Now, as consent for organ donation will be automatically deemed for people who've not registered a donor decision, many participants in this study believed that this would remove their choice and their voice, and that this would subsequently threaten their free will to make their own decisions. Therefore, you can see that for this group, opting out of organ donation was considered as a way of protecting one's freedom of choice. Now, participants also voiced a number of additional factors that influenced their decision to opt out. Now, these were largely expressed throughout the overarching notion of protection, and this manifested in 3 distinct sub-themes, which concerned the protection of one's life, one's body, and one's organs. So firstly, bodily integrity. Organ donation was considered to violate the physical integrity of one's body. And many participants, when describing this, used word choice that connotes harm, such as mutilated and tampered, to emphasise their viewpoint. Overall, participants reported that they had concerns that organ donation would leave their body disfigured and not intact after death, and that this would ultimately have serious repercussions for them during the afterlife. In addition, participants had concerns regarding the validity of a brainstem death diagnosis, and were really concerned that they might not really be dead when their organs were removed. In addition, the ideas surrounding medical mistrust also manifested in fears that doctors might not try as hard to save your life if they know that you're a donor and they could potentially get good organs. So there was almost this dichotomy between donor versus non-donor care, and a number of participants were concerned and would decide to opt out in order to ensure that they received the best quality of care from medical professionals. So I've discussed two themes which really concern the barriers to organ donation and the specific barriers under autonomy, government control, under the opt-out system. Now I'm going to move on very briefly to explore some of the specific concerns participants had with the opt-out system under the theme riddled with pitfalls. So throughout, many participants described a sense of stigma that was associated with the decision not to be an organ donor. Consequently, under this new law, where this group now have to take action not to be a donor, many felt that the act of opting out of organ donation would leave them susceptible to harmful judgments and almost ridicule from other people. In addition, a number of participants expressed concerns that there were individuals who perhaps didn't have the capacity to understand the legislative change and actually what it meant, the repercussions of this new system, and that they would be unknowingly assumed to consent for organ donation against their will. So overall, what we found was that emotional barriers that aligned with the existing literature, particularly medical mistrust and the belief that the physical integrity of the body would be jeopardised as a consequence of organ donation, were particularly important factors that influenced people's opt-out decisions. Our findings also suggested that participants who plan to opt out consider this new donor system as giving the government ownership over their body, and many expressed concerns that people may be coerced into consenting for organ donation. Overall, the decision to opt out of organ donation within this group appears to have in part been driven by these specific concerns relating to loss of free will, autonomy, and a threat to freedom of choice. So where are we now? And this is just a diagram of all of the studies, well, 4 of the studies conducted throughout my thesis. So within my interview study, we found that the decision to opt out of organ donation appears to have been in part driven by these specific concerns related to loss of autonomy and threat to freedom of choice. Now, arguably, what's interesting about these barriers is that these are somewhat distinct to the traditional emotional barriers. So they're not specifically related to organ donation per se. Arguably, they're somewhat specific to the nature of this new sensitive legislative change. Now, given these concerns centre around notions of coercion, loss of individual responsibility, and freedom of choice, I felt that the concept of psychological reactance might be a contributing factor here. So we decided to explore this in my 4th study. Now, we examined this specifically in relation to use of language and message framing within the campaigns designed to promote opt-out legislation. So firstly, for a little bit of background, we all have a sense of behavioural freedom in our life. Now, that's just, in short, choices that we feel we should enact or we should be able to enact without restriction or coercion from external sources. Now, reactance occurs when we feel that our behavioural freedoms have been threatened. In response, this results in anger and negative cognitions, usually counter-arguing towards the source of the threat. And overall, it motivates people to take action to restore their freedom. Now, this often takes the form of a boomerang effect, whereby people will actually engage in oppositional behaviours, and it's quite common in young children, for example. Now, importantly, evidence shows that our behavioural freedom, or our desire for behavioural freedom, becomes stronger when that's perceived to have been threatened. And these images demonstrate this fairly well. So in the context of this talk, the choice to be an organ donor is categorised as one of these free behaviours. Now, if people perceive that choice to be under threat when they read or when they hear about the new opt-out system, they may be driven to opt out of organ donation to restore their freedom and protect their individual responsibility. Now, reactance is very sensitive to use of language, in particular whether the language used in communication campaigns, for example, is perceived to be high-threat language, which often features a direct, persuasive terminology, or low-threat language, which features milder, more autonomy-supportive language. Now, given the often direct and somewhat persuasive nature of public health campaigns, this might explain why they can have undesirable consequences. Now, a number of studies have examined this in the context of health decision making. In the following study, the authors manipulated the language threat level, high threat versus low threat, of public health campaigns that were designed to promote teeth flossing and reduced alcohol consumption. And in red, you can see an example of the high threat language manipulation used. Now, that's a particularly strong manipulation, and this is something that we wanted to address in the current study. Overall, the results indicated that people who were exposed to the high threat condition, they experienced heightened threat to their freedom and anger in response to the campaign, and this in turn decreased intentions to engage in the promoted behaviours. Now, this has been replicated across a number of health behaviours, but there has been no research that's explored this in the context of opt-out organ donation. In addition, in relation to communication campaigns, the way that messages are framed, for example, a gain versus loss frame, also plays a role in people's behavioural intentions. However, the evidence base is really inconsistent in relation to organ donation. While some studies have reported that gain frame messages, now these are messages that highlight the benefits of engaging in a particular behaviour, some studies have found these to be most effective at increasing intentions to donate, while others have found no differential effect. So we wanted to explore this in the context of opt-out organ donation. So at the time of conducting this study, there was a nationwide media campaign that was ongoing throughout the UK to promote the upcoming opt-out system. However, no research had explored the best way of communicating this change or the impact of specific message features. Now, in this study, we followed a 2x2 design whereby the language threat level and message framing of organ donation campaigns were experimentally manipulated. And we predicted that high threat information and loss frame manipulation would act to reduce intention to donate. Now, this was an online study that was hosted via Qualtrics. We had 1,350 participants from Scotland and England took part. Participants had a mean age of 36. We had a substantially higher proportion of female participants, and our age range ranged from 18 to 95. So I'm going to go through the study procedure now. So we took baseline and demographic measures here. These were and then after we took baseline assessments, participants were then presented with a newspaper article that we had manipulated the language threat level and the message framing of the article. These were designed using Adobe to represent or to look like a newspaper article to try and make them as ecologically valid as possible. Now, our primary outcome measure was donor intentions, and this was measured pre and post message exposure. We also then measured reactance, and that was conceptualized with threat to freedom, anger, and counter-arguing. And this was measured immediately post exposure to the newspaper condition. We then also measured credibility and readability of the articles, and all of these were measured on a 7-point scale. So there are 4 conditions throughout this study, but I'm going to go through 2 of them briefly. So overall, the language manipulations were informed by existing literature, the findings from a previous study, which I've just discussed, and existing organ donation press releases. So I've highlighted the low threat components in green. So you can see that we used autonomy supportive language here. Adults will be considered to have no objections. If you do not want to donate your organs, you can always choose to opt out of the organ donor register. So you can see that these are designed to promote choice. And our gain frame manipulation, which speaks about the positive impact of organ donation, details how many people's lives were saved as a result of a life-saving transplant in the last year. Now this was our high threat and loss frame manipulation, and you can see that the threat manipulation is highlighted in red, and we used direct language, forceful adverbs and imperatives. So for example, if you do not want to donate your organs, you must now opt out of the donor register. We also made reference to the donor system as the government's new law and used the phrase presumed consent. Now, this has emerged within my interview study as something which had particularly vexed the participants, so we felt it was useful to manipulate that language. And our loss frame manipulation, which stated how many people had died during the active wait for a transplant in the last year. So again, our main objective was to test whether manipulations in language and framing influenced intentions, and we found that it did. We used a mixed ANOVA and we found a significant group by time interaction. We then broke this down and explored the changes across each condition. As predicted, people who were exposed to condition 4, so that's people who received high threat language and a loss frame, experienced significantly lower intentions pre and post exposure. However, for participants who received condition 2, the high threat and gain frame manipulation, their intention significantly increased pre and post exposure. To tease this apart, we then examined the impact of our manipulation on specific measures of reactance. So framing, those who were exposed to the loss frame conditions, and that's highlighted in purple. Last year, 400 people died while waiting for a potentially life-saving transplant. They reported heightened anger in response to the message in comparison to people who received gain frame manipulation, so reporting the number of people whose lives were saved as a result of organ donation. In relation to our threat manipulation, participants who received the high threat condition viewed the message as a significantly greater threat to their freedom, and they also felt that the message was significantly less credible than those who received the low threat autonomy supportive messages. We then conducted a supplementary analysis, and that was to assess measures of reactance, so threat to freedom, anger, and counter-arguing across our different donor groups. So at the beginning of the study, we asked participants whether they planned to opt in, follow deemed consent, were not sure, or would opt out. So the findings ultimately demonstrate that participants who plan to opt out and those who are unsure of their anticipated decision at that present time were at risk of experiencing a heightened reactant response to opt-out organ donation campaigns. Overall, both groups appraised the opt-out messages to cause a significantly greater threat to their freedom and reported heightened anger and counter-arguing than those who planned to donate their organs. So that was people who planned to opt in or have their consent deemed automatically. So finally, what does this mean? Overall, we found that very subtle manipulations in language and framing play a key role in donor intentions. From this study, we would recommend avoiding overtly high threat language and loss frame statements to try and safeguard threat to freedom and to maintain credibility when promoting the new donor system. Although the use of gain frame messages, which encourage people to think about the number of people whose lives have been saved by a transplant, might serve to buffer the effect of high threat language, and future research is required to test this. In addition, existing studies have suggested that across health communication literature, that using a restoration postscript message, so stating, for example, after this message that organ donation remains your personal choice, is actually effective at reducing reactance, and this should be explored in further research. So to wrap everything up, overall, throughout my thesis, I found that in support of the existing opt-in literature, maintaining a sense of bodily integrity after death and fears of medical mistrust were particularly notable factors in the planned decision to opt out of organ donation. Now, a limitation of my research was that donor behaviour was measured using intention, and that was really unavoidable because at that time the opt-out system had not been introduced in Scotland or England. Now that the law has changed, a natural progression of my research would be to examine the discriminant utility of these emotional barriers between verified donors and those who've now actively registered an opt-out decision. Now, in relation to reactance and communication, there's now a 5-year media campaign that is underway to promote the legislative change. Ultimately, future studies that examine the media coverage throughout the legislative change and the role that this may play on the development of reactance, public attitudes and intentions is an important area for future study. In addition, as I mentioned before, future research that examines these evidence-based techniques that are designed to try and reduce reactant responses would be a crucial next step to this research. And I'm hoping to conduct these studies in a postdoctoral fellowship that I've recently been awarded. So thank you all for listening, and I would welcome any submitted questions. Thank you very much.